How are you, as a Christian, going to be different from a non-Christian nurse? How is your faith going to make your practice different from somebody who's not a Christian? It's not going to make you a better nurse, but what is going to be different about you as a Christian nurse? Our students come with Christian values, and we point out and we show them how to use those values when they're caring for other people. The other thing that we try and teach them is you are a child of God taking care of a child of God. And it's not always easy, but God has a plan for both of you, and therefore you are special. We have a 4-year bachelor's degree in nursing. Students take both nursing courses and college courses, liberal arts courses, science courses, psych courses, all 4 years. So they're both Dordt students and nursing students at the same time. They spend at least 2 hours a week in the lab practicing their skills in the context of patient care. They go to simulation for 7 semesters to really work on some extra care. They go to clinical 7 semesters in local hospitals. They'll have their clinical at about 12 different hospitals, so they'll get a nice variety of different places. So first of all, we have fairly small classes, which is really nice. So in the classroom, you can get some personalized attention. Every student has a nursing professor as their advisor to help them out with scheduling and with figuring out where they're going with classes and where they want to go for clinical. We have an 8-bed lab with a lot of supplies, and so that's where we want students to keep practicing and practicing and practicing so that they don't have to worry about their medication administration or how to set up an IV when they're at clinical. When they're at clinical, that skill can be automatic and they don't have to worry about practicing the skill, they can worry about their patient instead. We also have a 2-bed simulation lab with some really great high fidelity simulators in it. And so students will come to simulation once or twice a semester and not really be evaluated, but just practice certain scenarios. So our mannequins in simulation can be elderly, they can be children. One of them actually delivers, so she actually delivers a baby.
The best way that I've learned here is through when the professors first teach us a concept, and then after that they'll go through like a patient scenario that puts the concept into actual real life terms. Something really exciting that we just learned about, for me, that was really exciting, was vital signs. Because that's something I do a lot as a CNA. Like at the beginning of every month, we go through the facility and take all the residents' vital signs. So it was really fun to be able to see like, oh, this resident has low oxygen saturation. And then because I just learned that in class, I was able to like understand what was going on in that person's body, and like that kind of a thing has been really cool to see.
Every year, starting your sophomore year, you will take a health and illness course. Each of those courses, you spend 2 hours a week in the lab with that course, practicing the hands-on that has to do with the concept you're studying in class. And then you also go to clinical. And so your clinical is correlated with the content in the course. You will also take what's called a professional course every semester. So the professional courses are things like professionalism, standards of practice, healthcare systems. There's even an advanced health assessment course. So those kind of just professional courses about the rest of nursing. You also take 3 pharmacology courses, learning about medication administration, practicing medications.
Dordt does a really great job of integrating faith into the nursing major. So far, every single class period that I can remember, we start out with devotions and prayer, and we'll like take some time to discuss the devotion sometimes. Just having classmates around you who are also Christians, it's really cool to like get to study with them and to just discuss like getting to take care of people so that you can like help them become the person that you know like God created them to be, despite like seeing them at a really low point in their life. You can just tell all the professors really care about you so much, and like they want you to do well, and they want you to feel like what you're doing in college matters, and like they want to see you do what the Lord is calling you to do, even if that's not nursing. And it's just such a great community here of like professors and classmates who all want to see each other do well and yeah, thrive.
So to become a nursing student at Dordt, all you need to do is declare your major as nursing. We have given every student the opportunity to make it in nursing.